I think the best thing about healthcare at the moment is that the services are quite good in times of crisis.
The amount of drop-in centres there are, I can just walk down to the drop-in centre and just go in, tell them what's going on, and they can just sort me out on the day.
So I went to a hospital the other day and they had like automatic kind of appointments and checking and things. So that would be really nice to see around other hospitals and doctor surgeries.
I think it's good that it's free. We don't have to pay for health services and we can generally find them locally.
If they find something that's wrong with you, they'll act fast on it and they won't take their time.
I think the most challenging thing is understanding. I don't think that all the health professionals sort of understand the patient and look at the bigger picture for them.
I can't see doctors on evenings or weekends because of my schedule, so it feels like I have to fit my schedule around them.
You go through a lot of changes when you're a teenager, so they just kind of assume it's those things and they don't really do much about it.
The most frustrating thing is that when I'm in the doctors, I will have to wait a while before I can get seen.
I think the waiting times are really, really bad.
They say it's meant to be like half an hour, but I eventually stay up for 2 hours or 3 hours roughly. And well, that actually makes me miss lessons, which has a negative impact on me because I don't feel like turning up to my appointments.
My wish would be that doctors' surgeries would be a bit more welcoming, that there'd be a bit more up-to-date and modern technology involved, so like you can't use your phone at the moment, but it would be great if I could go in and just use my phone and go on their Wi-Fi.
I think some hospitals are starting to use more technology, like in terms of automatic appointment booking and online systems, but I think they could use more of that in different parts of the country.
I would say if they had something called virtual clinics, that would benefit me and well as other healthcare service users. Well, I could just Skype them on social media websites and get seen rather than missing it.
I'd like to see maybe we could have faster time, maybe put more funding into getting more doctors.
If you're under 2 different teams or something, I feel like you have to repeat your story again and again. And if there was just more consistency and communication, I think it would be a lot easier and a lot less tiring for the patient to have to keep repeating the same thing.
I think they should listen to young people more and instead of just passing it off as nothing, investigate into it more.
I would say making certain stuff more available and more noticeable to people, like say condoms and sexual health. There's a lot of STDs going on out there. What are you lot doing? I don't think anyone listens to the young people enough.
I feel it's really important that young people have a voice. I feel like we could be listened to a bit more because young people's voices are often left unheard and we're not really taken account of.
Well, the young people, we have a mind that is more advanced than yours, even though you don't think it, because obviously we're not as old as you. You lot's got experience, but we've got a younger, faster working mind.
They should be listening to young people, taking their ideas and applying them.
If the adults listen to the younger minds more, then we could get somewhere a lot faster.
If they get enough comments from young people, then I'm sure they'll listen.